Finding the central sulcus is one of the things that we have to do to identify lesions that might be anterior to the central sulcus, meaning frontal lobe, motor cortex, and posterior to it means parietal lobe. One of the ways to see using the axial cuts, this is non-contrast CT head. If you go to the higher cuts, you can find this little bit mustache marginal sulcus called marginal sulcus. Just anterior to it, you will find the central sulcus just anterior to it. So that means that this is the frontal lobe, and this is the motor area, and this is the parietal lobe below, posterior to the central sulcus. If we go to sagittal, you can use cingulate sulcus to identify the sulcus, the central sulcus. So you go with the margin or the cingulate gyrus, and then once it kicks up, it's called marginal sulcus, the same one we saw in axial cuts. And just anterior to the marginal sulcus, should be the central sulcus. So this is the motor area, and this is the sensory area in the parietal lobe. If we go to the MRI, it will be a little bit more easier to identify the central sulcus. So this is the mustache marginal sulcus that we talked about, and just anterior to it, you will find the central sulcus. This is the motor area, this is the sensory area in the parietal lobe. If we go to sagittal, it looks easier here. The cingulate sulcus, you just follow that to the, once it kicks up, it's called the marginal sulcus, and just anterior to that will be the central sulcus. Thank you.